Governor, nice to see you, sir.
Hey, Greta, how are you?
I'm very well. Governor, I know you have a new health care plan to replace Obamacare, and just at the outset, I should tell you my position is I really, really, really want everyone to have access to medical care who needs it. However, I think that whatever program we have ought to be able to be easily understood, and I see Obamacare much like the tax code. You have to have a PhD to understand it, but frankly, yours is complicated as well. And appears to have the same some of the pitfalls in terms of understanding it that Obamacare has.
No, ours is pretty simple. It gives patients and their families the freedom to choose their health care decisions and the freedom to choose where their money's going. If you get your health insurance from an employer, you'll continue to get it. The only difference is we think our reforms will actually see premiums go down, so that'll be good news for you and your employer. If you're someone who doesn't get health insurance from your employer, maybe you're working part-time and going to school, or maybe you're someone who just started up your own small business, we give you a tax credit. The tax credit's not based on your income. It's based simply on age, like it was before Obamacare, and it's simple. It gives you a tax credit. You get to go out and buy health insurance on the market. The government doesn't dictate that to you. And on top of that, everybody gets $1,000 to put into a health savings account if they choose to do that. And we lift the contribution limits, and we allow you to roll it over to your children and your other family members. It's a pretty simple, straightforward plan that will allow people to have affordable and accessible health care without the $1 trillion worth of a tax increase that Obamacare includes,
right,
and without having the stipulation of the federal government.
Governor Jindal says it's just another another entitlement program. I take it you disagree with him on that.
Well, I've seen conservative columnist after columnist say this is one of the best plans out there. It's one of those where people like Governor Jindal and others have actually talked about tax credits before, so it's an interesting change of pace here. What people are saying overwhelmingly is we put people back in charge. We put patients and families back in charge of the health care decisions. We get rid of the government mandate. We repeal Obamacare immediately. We send that to the Congress day one. We get rid of the special treatment for Congress that President Obama gave them. It's a great deal going forward, and we let people choose where they spend their money and how they spend their money.
Okay. Let me ask, yes or no, is Medicare, just so I understand where we're both coming to this, are Medicare and Medicaid single-payer systems or not? Do you consider them that?
Well, Medicare we don't touch with this proposal. Medicaid we literally send...
I mean, just in general. I mean, do you see that as a single-payer system, both Medicare and Medicaid? Would you call it that?
Well, I'd actually like to reform Medicaid, which is why I'm giving it back to the states so that there is some of the more flexibilities that we have.
All right, I'm just trying to understand what you think of those two programs, just how you would classify them.
Well, they have similarities to it. I don't think they're exactly the same. Probably the closest thing we've got to is some of the problems with the VA system, which is exactly where we'd head if we went down the path of Hillary Clinton.
I guess what I'm trying to get at is this: I see Medicaid and Medicare as single-payer systems. It's the government paying for it. I see your system where you give credits as that's a cost to the taxpayer. And I'm just sort of trying to get a grip of whether these programs really are truly complicated, so that the average person can understand them. I mean, there's so many elements to them, and I guess that's where sort of my struggle with it is. I've gone through your plan, and yes, it's simpler than Obamacare, but it's got all sorts of problems. For instance, you've got to get it past the U.S. Senate and get 60 votes. And then, of course, if you do get it past the U.S. Senate, should you be president, that's your first problem. Then you've got to get it past state legislatures, because state legislatures have to okay these, because you assign much of the responsibility to state legislatures. A lot of them are not going to be able to sort of trust Washington, want a lot of things coming out of Washington. So it is actually quite complicated, in the end.
Well, I think it's pretty simple. We send it up to Congress at day one. I don't think the Senate has to have 60 votes. There's nothing in the Constitution that requires the Senate to pass anything with 60 votes. I'd say light the fire underneath the Congress by getting rid of the special treatment. They have to live with the same premium increases that the rest of America does under Obamacare. I think they'd start acting on it pretty quickly. That's why I want to act on this in day one. I'd say pass it with 51 votes, just like we do in our state legislative bodies. Get it through the Senate, get it through the House, get it passed right away. Repeal Obamacare once and for all, lock, stock, and barrel. Every part of it, even the parts that Nancy Pelosi supposedly didn't read. And then it's simple. If you get health insurance from your employer, your premiums are going to go down because of the reforms we put in here, and by repealing Obamacare, it's going to be one of the biggest tax cuts that we've had in some 40 years, probably the biggest we've had since the Reagan era. And if you don't have health insurance from your employer, it's pretty simple. You get a tax credit. You don't have to do it. You don't have to use it. It's up to you. That's why it's called the Day One Patient Freedom Plan, because the freedom goes back into the hands of the American people and their families.
Governor, one last question. Governor Jindal wants to debate you on this. Any interest in debating him on your plan?
I think in the end, I'm going to debate people who are on the panel with me at the next debate, and if he makes the cuts or anybody else does, I'll be debating them no matter how they mix it up, whether they mix it up or they do it by the top 10. I'm ready to talk about this with the American people. I'm not looking to pick fights with one candidate or another. I'm looking to go out there and talk to the American people. I'm not intimidated from anything. And to me, the best debate I'd love to have is with Hillary Clinton on this. Hillary Clinton was for this kind of plan long before Barack Obama even pushed Obamacare. In '93, the early 1990s, she was pushing Hillary Claire. She talked about a government mandate in the 2008 primary election. She would make this even worse, you know, for the promises. If you like your health care, if you like your doctor, you can keep it. That was PolitiFact's lie of the year. Think of all the people who have seen their premiums go up. Think of all the people who had employer coverage that now have been dropped. Think of all the people who thought there wasn't a tax in this, and there is. I'd love to take that on with Hillary Clinton. I'm not intimidated by her or anybody else, and I'm certainly not intimidated by my own party. I'm upset that we were told that if Republicans had control of the United States Senate, there'd be a bill to repeal Obamacare. There's not one today. It's August. They've been in control since January, just as I did in Wisconsin. I'm not just going to stand up against the unions or the Democrats. I'm going to stand up against the establishment of my own party to get the job done.
Governor, nice to see you, sir.
Thanks, Greta.